What I would like to do now is go directly into the Q&A, because I think that although we can have an interesting conversation among ourselves and then open it up, it might be more interesting to actually to open it up to the floor and have you folks pose questions or comments about what you've heard so far this morning, so that we can just start this conversation. Please, can we have a microphone here in the front row for the Minister or the Commissioner?
Sorry, I didn't want to be the first, but as I'm leaving, I want to take this opportunity to ask you this question. One of the big challenges that we face in Europe is, of course, we all know we are 27, very soon 28 member states. And when we want to take policy decisions, we have to rely on data from the 28 member states, and very often from neighborhood countries as well. And ministers are always telling me, oh, we are tired of you asking us for data. Data for this, data for the other, data for the... And it's very consuming time-wise and money-wise. Do you see any prospect of simplifying this enormous task? Because unless we have reliable data from the member states, we cannot really see the size of the problem and how we can face this challenge separately in the member states, because we cannot adopt one uniform remedy for all of them, depending on the size and the nature of the problem in each member state. So how do you think this will help us?
Well, I think part of our remit is to help countries do exactly this, is to create, I'd say, more data literacy within organizations, because the costs do not have to be astronomical. In fact, the costs are coming down dramatically. And in the UK, within the ICT sector, we're looking at 90% reductions in cost around all of our IT spend. That's the kind of objective. There are very significant moves and backing from the UK Cabinet Office, the government digital services, and from ourselves to enable government departments to publish more open data in a more cost-effective way. And actually, open is cheaper. I think that's one message I'd maybe leave you with. Open is most definitely cheaper, because your other stakeholders can help improve the quality of your own information.
I think perhaps the other way to do it is to show the value to the constituent countries. So I know at Google we often try to get public data. For example, we just launched our public alert system in Japan. So we show warnings of tsunamis and bad weather and things of that form. At Google, we had to get data from the various authorities there. We do this in the US. We hope to do this in Europe soon. If we don't have a lot of users that use it, the agencies don't want to give it to us. But we think we will, and we think it will benefit the public health and well-being, and that will convince the agencies to spend a little bit of time with us to get the data. One of the issues, though, just to keep in mind with all of this, is the beauties in the details. How good is the data? You had a point up about that. Consider if you're doing warnings to people about public health emergencies and you're giving people warnings, you want to have very good data. Right? You don't want to scare people in such things. So there are situations when you have to really understand very, very carefully the quality of data. It's not like spelling correction. If you make a mistake, so what? Right? These are things that could be very important.
I think, I mean, one of the things we looked at was the cost of the energy companies supplying data to us as an entrepreneur, and how would we encourage them to do this? Now, a lot of the open data initiatives so far have made the data available for free to the public, and that's great, and it'll encourage a lot of innovation. But if there's value in the data to the European Union in policy decisions, there's probably value in the data to people involved in the education ecosystem who might want insights into how people are learning, and that could be monetized. It's the same data, you're doing the same processing, and it could be part subsidized. And by doing that, it provides additional revenue, which could encourage more data to be exposed and more instrumentation to become involved and lower the cost to the taxpayer for providing the same data.
I think just one final example is back to the health example I gave, is the health service in the UK initially had the classic kind of response of the sky will fall if we make this data open. We can't open the information. But look at the potential saving. But that innovation was done outside of that system.
Yeah. All of those answers are very interesting. I'd crystallize them by saying the first one is that if the data was more publicly available, you wouldn't have to have people, an ecosystem would exist to provide policymakers with the data that they need, and you don't have to turn to your internal resources to do it. Secondly, if you bolt on the idea that you can have a commercial incentive for the generation of some of this information, that you don't need to rely on national statistical agencies to do it, you can imagine the data being better, more timely, different, and more appropriate to help make decisions. So these two areas that are actually mutually exclusive in a way, a marketplace that's vibrant for data and public data made open. I would say there's two other parts to the answer. The first one is that I'm going to presume that in many instances the data that you're looking for actually already, that policymakers want to make decisions, already exists. It's a question of finding it and processing it. So there, the second point is, traditionally in public policy, the requirement to check in as a professional is a law degree, and that's going to have to change. What you're going to want as part of your staff and throughout the administrative apparatus of federal and national, or actually government bureaucracies, are mathematicians, statisticians, and computer scientists, and software developers, people who come from a different background than traditional public policy to help policymakers make decisions. People who are accustomed to working with data and not with the other kind of code, which is law. Okay. I see a question there.
Hi, I'm Kumadev Chatterjee. I'm the founder and president of the European Young Innovators Forum, and we are putting together a convention in a few months, which is really about, one of the topics will be open data, and what we call smart data, which is the other end of the spectrum. So the question was really to all three of you. I mean, since you've been in the field, and some of you talked about the application space. For young innovators, entrepreneurs who want to enter that space, what are the key areas that you see as developing? Obviously, healthcare is a large domain, or let's say research into semantics is a large domain. Lifestyle research is a large domain. What are the sort of more trendy areas, or the more areas where you can see that the applications can happen within a short space, so that young innovators can sort of plug into that?
Well, I wouldn't be at all surprised if we start to see a lot more successes in the healthcare arena, but I'd say it's all of the above. I mean, the amount of innovation that we're seeing is really, it's across the board. There is not an individual sort of pattern emerging. It is just like the beginning of the web again. We've got in-house startups working on buildings, working on energy, working on location-based services, on transportation, and on health. And that's just the 5 that we have in-house now. We're seeing emerging interest from supply chain analytics, economics. We've got open corporates now as well. They've got data for 50 million companies. So opening up the economic supply chain, opening up governance models, beneficial ownership. These are all huge initiatives.
I'd answer it just by saying, sweat the details. The whole breadth is correct, but many of the things don't work easily. So for entrepreneurs, they're not a good space to be in, and some of them do. So if something just seems like it's a good idea, but you can't make it happen because someone doesn't want to be disintermediated and provide data, or there are privacy issues that are too complex, or there are public policy issues that they're debatable, those may not be good spaces. So be careful, but there is enormous breadth and opportunity.
I would add, look for areas that are easy to instrumentize, okay? So healthcare is easy to instrumentize. We collect data today. The problem, though, is that, so in some ways it's a very easy thing to reach for, and you even cited it in your remarks, but the problem is that laws exist to actually actively discourage the sharing and the processing of data. So for an entrepreneurial venture, that's probably the place not to go. You could do it, but if you're sort of on the margins of it and you kind of have a realistic view of what's feasible. But think about automotive, right? The car is just simply these days a vast supercomputer with 4 wheels. So if you instrumentize lots of parts of it, you can imagine doing great new things with it. One simple example would be when a car is about to break down, it doesn't do so all at once. It typically happens over time. And we know that as drivers because the steering wheel's not, it just doesn't feel quite right when we drive it, or we can hear something funny. And if we throw sensors into the motor, we can identify what is normal, heat and vibration, and what an out-of-bound range is for the data signature that it's producing, because it's getting a little bit too hot, for example. And we can predict if there's a breakdown prior to the breakdown happening, send the driver an alert to go to the service station to get the part replaced. Obviously, automotive companies like this sort of application. It does exist for commercial fleets, but doesn't exist more broadly than that. And so when you think about it these ways, it's not to say that automotive is the industry. I mean, I think it's a very interesting one, but there's a lot of barriers for entrepreneurs to get into it. On the other hand, just thinking about what can I instrumentize to collect data on at scale will be your first step into looking for commercial opportunities.
If I may, when we looked at an awful lot of the open data that's available today, and London's a great example. There's fantastic data available all about London and traffic, and there's also a great web page that collects applications and innovation around that data. And of course, a lot of the early adopters here are just reproducing the same information in a different format. So you can get an app on your phone that tells you how many parking spaces are available. But it's not doing anything with the data but showing it to you again. And what we found when we started to look at this is the data's there. But if you start to combine it across different marketplaces, we talked about this, the speakers here talked about this, when you start to combine it across different marketplaces, and in our instance it was energy and traffic information, but that's when you see some really cool insights start to appear and where a lot of value can be generated. So you take the data at face value and then combine it with data from another source. So, I mean, the information about the drug costs and what prescriptions are on a geographic basis. Well, I wonder if you combine that with housing density or environmental factors, you start to see trends in common illnesses and where things are starting to occur. So you start to just to combine it and you get some great value coming out of it. And there's a lot of potential there to do that with what's available today.
Great. I see a question here and then a question there. Why don't we go first to the gentleman here? Thank you.
Mark Speich from the Vodafone Institute. I have the feeling that the concept of privacy is informed by cultural, legal, and social tradition. So what does that mean for the topic? Would it mean that societies that are more sensitive to the concept of privacy will be less innovative in the future in the field of data-driven innovation? And if so, how to help them?
Before we answer that, that's a very meaty question. What I'd like to do is get a few other questions out and aired, and then we'll have a summation and we'll address privacy at the end as well, because we are running out of time. So let me ask the gentleman there to ask a question.
My name is Paul Docherty. I work for Axon O'Barron as a knowledge manager. I guess I'm not so much asking a question as a request for a comment. Gavin's interesting example about the use of healthcare data to bring down the cost of statins was really interesting. And you mentioned that it could come at no cost to jobs. But having seen AstraZeneca's results last week in the layoff of 1,600 R&D staff, I'm concerned that actually that's not true. And what it does is it democratizes the choice to the NHS and gives the opportunity for great savings, but at the cost of a business model that has been relying on people not being able to do that for a long time. And we saw another example to the airline industry, that the openness of data. So perhaps actually there's a greater threat here to traditional business models because of the openness of data.
Are there any other questions before I then turn to the panelists to submit? I see it.
It's going into the same direction, I guess, coming from the background of being biomedics. The interest and the challenge is really in how can we make between, let's just say with the EC, I think the 27 different healthcare arenas comparable in, and getting access to statistics. And just a word, In the United States, you have the Atlanta Center of Disease Control, which has an anniversary budget of a couple of billion. In Europe, you have the Center of Disease Control, which is adjunct to the Karolinska Institute, which has 1 million per year. So I guess just this is this, you talked about order of magnitude. How can we fill this gap when we like to make a statement about the 400, 500 million Europeans to one healthcare question?
Okay, the challenge to business models, the ability to rally statistics on a continent-wide basis, and privacy.
Well, a lot of those seem to be directed in my sort of general area, so I'll maybe begin here. So first of all, personal data is not open data by default. You have to opt in. That's a basic principle. But there are many ways of creating aggregate information and aggregate statistics which provide the same meaningful insight that don't undermine privacy. So I think those are difficult questions, and very meaty questions, but they are navigable with, so approach with care, I think would be my piece there. On the threat to jobs, well, it's very interesting. So the drugs companies use the same data to track the performance of their salespeople. But I would also say the benefits of open data, for example, in clinical trials, may vastly outstrip the benefits that I just demonstrated there. And actually, how can we encourage the sector to invest more in R&D and less in marketing? And I think there's a balance there to redress, because we have, in my opinion, very personal opinion, swung too far away from investing in R&D at scale.
I think it's not true. I think the 20 largest big pharma firms have increased in the last 10 years about sixfold. So they're spending 40 billion euros per year in R&D. But each year new registered treatments and drugs are only stagnating at 15. Just that's the reality.
Well, that's great. Why? But is that, well, that's maybe a much bigger question, but why?
Because I think only one idea starting at the lab bench in countries is coming to a final registration in phase 3. And I think the cost in also compensating for all these phase 1, phase 2, phase 3 trials, okay, have to be incorporated into costs, and I think the regulations are.
So, no, I agree. So that we can't have transformation without some disruption along the way. So I would expect it to be a bumpy ride for many people. Now, that would be business as normal if you work on the web.
So I think the comment about the drug industry and the fact that it has effects when you do this is a very good one. One of the places to look at data may not be open data in all cases, but big data is whether we can get our arms sufficiently around genomics, proteomics, and do more intelligent drug design, and then can we do more efficient phase 1, phase 2, and phase 3 trials, which are extremely expensive. So there's every reason to believe that in the fullness of time, it's not easy because of all the privacy regulations and such things, but it's extremely important for society that we reduce the costs of these studies, we enroll people more easily, we are able to monitor the outcomes more effectively. So I think there's a benefit to pharma that is something that will happen. I know there's a lot of focus on that today in that industry. And on the issue of privacy, a very thoughtful question, I think. First, it does worth repeating, it bears repeating that much of the data that is being proposed to be used is not subject to privacy concerns in any country, I think. I think it's just not an issue. So the Google Translate system is a tremendously valuable product, but it uses only publicly available data to generate the translation rules. So there's just no privacy issue. It's equally accessible to, in fact, all the work was led by a wonderful student named Franz Oak, who came from Aachen University in Germany. So just tremendous work and came out of a country with enormous privacy concerns, but no issues. I think on the issue where there is personal identifiable information and the like, there's just likely to be give and take in society as generations change, as countries evolve, as value is shown, and that all of us have to, certainly in industry and academia that are interested in pursuing this, have to be very sensitive to all these topics. But I suspect there's a lot of evolution that will happen.
Yeah, I mean, in terms of privacy, the point I was trying to make was, and it's the grain of sand to the beach analogy, when you look at big data, a lot of the value that comes out of it, and a lot of the examples here are statistical analysis of vast sums of data. And when you do this, you get this aggregate view. You don't see the individual, and you don't want to. It's actually of little value to you. You want to see the trend for the greater society, not what the individual is actually doing. But there needs to be, I think, perhaps a cultural shift too, because a lot of people get very worried very quickly about exposing this information. And there needs to be some education here in showing that what we're actually after is not your personal information, but the aggregate view of what everybody's doing. And there is no real risk if this is followed properly, and yes, you do have to approach with caution. But there is a bit of work there to do to help that public perception, that shift and change in viewpoint. And it's an interesting problem.
Can I just come back with one other small bit of data here? Is £1 billion is about 50,000 nurses. So which social problem do you want to fix?
Well, thank you very much. Please join me in thanking the panelists for their contributions.